Hi, in this section we can see some of the questions from burns. Which fluid is preferred in first 24 hours after major burns? The answer is ringer lactate. The ringer lactate is otherwise called it as Hartmann solution. Why this fluid is encouraged? Because this fluid is closely resembles body plasma and helps replace the fluid and also electrolyte loss effectively. The second question is, which lab value should be closely monitored in electrical burns? The answer is serum potassium level. Why? The muscle damage releases potassium into the bloodstream, leads to hyperkalemia. So the hyperkalemia leads to cardiac arrhythmias. The third question is, why the burns patient at risk for infection? Is due to or it is because of loss of skin integrity. So the skin barrier is destroyed, making the tissue vulnerable to microorganisms. The fourth question is, why the deep burns often painless? Because the nerve endings are destroyed, especially in full thickness burns destroy the pain receptors too. So that results in little or no sensations. The fifth question, why a nasogastric tube is used in major burns? To prevent vomiting and gastric distension. In the case of burns, the stress decreases gastrointestinal motility and may cause paralytic ileus. Why should diuretics not be used during the initial shock phase? Because they should avoid because the fluid loss in burns is due to plasma leakage, not fluid retention. So the diuretics worsens the dehydration. Why urine color observed in electrical burns? Nothing but to check for myoglobin in urine. Muscle reduction releases myoglobin, which can block renal tubules and cause kidney failure. Why should the burn patient avoid sunlight exposure during healing process? It's nothing but to protect the new skin. Means the new epithelial tissue is sensitive and can easily darken or scar when exposed to UV rays. Why the early nutritional support important after burns? Because a high protein, high calorie diet is required is because of burns increases the metabolism and protein breakdown. So the proper nutrition promotes tissue repair and immunity. The 10th question is, why do the burn patient often develop anemia? Due to loss and destruction of red blood cells. It's because the tissue damage and bleeding reduces the circulating RBC count. The 11th question is, the stress ulcer occur in patient with severe burns because severe burns causes decreased blood flow to the gastric mucosa and increased acid secretion leads to mucus damage. The 12th question, antacid or proton pump inhibitors are given to burns patient because to neutralize or reduce the gastric acid secretion and prevent the development of stress ulcer or Ehrlich ulcer. The 13th question, early enteral feeding is started in burns patient. Early feeding maintains gastric mucosal integrity and also increases the blood flow to the stomach and prevent stress ulcers. The 14th question, emotional and physical stress should be minimized in hospitalized burns patient because the stress increases cortisol and catecholamine level which raise stomach acid and delay healing. The last question, early physiotherapy is started for burns patient to prevent stiffness and contracture formation by maintaining normal joint movement and muscle strength. damage and also ulcer formation. That type of ulcer is called it as Ehrlich ulcer.